Adjunct Professor Kylie Ward. I'm the Chief Executive Officer of the Australian College of Nursing.
I'm Adjunct Professor Alana Geary, and I am the Chair of the Workforce Sustainability Policy Chapter for the Australian College of Nursing. I am also the Chief Nursing and Midwifery Officer for Metro North Health in Queensland.
My name's Natalie Reyes, and I'm currently stuck in Mexico, trying to come home back to Australia after 3 years overseas. I have a background in intensive care nursing, where I worked in a tertiary hospital for over 4 years.
My name is Hayley Pollock, and I'm a final year Bachelor of Nursing student at Swinburne University of Technology in Melbourne. I'm also an emerging nurse leader with the Australian College of Nursing and the co-secretariat of the Melbourne region for ACN. Now that I'm at the very end of the degree and wrapping things up, I've completed the required 800 hours of placement across 6 different hospitals in the degree. And it's been interesting because most of those placements have happened in the thick of the COVID pandemic. The very first one, which was February last year, we were asked to sit down and sign something to say we hadn't been in Greater China. But everyone laughed, saying, of course we haven't. We've been here working with you. But we didn't know what was coming. And across the different hospitals, through the ins and outs of COVID, we've seen just how stretched the nurses are. Usually you would have a clinical educator who comes around and sees you every day, but they're often being pulled to the floor. The nurses are exhausted, they're burnt out, they're really scared because they have their own healthcare concerns. As a student, usually nurses are very supportive of you and they're there to guide you through your learning. But unfortunately, when we've been faced with really tough situations like a patient passing away, we don't have that support, or the nurses don't seem to have the capacity to deal with supporting a student through that. And that's really hard to manage. Becoming a registered nurse is so close. I can now sort of see the light at the end of the tunnel, but looking ahead, it makes me really sad that that's how our workforce has gotten to. We've gotten to this point where it's sort of just expected that everyone is burnt out and tired and losing motivation. I'm really proud to have seen how nurses are so resilient during this extraordinary time and how we've all pulled together. But as I start to enter the profession, I really hope that things can change and that we can support students because we're supporting nurses.
In 2019, I travelled to Colombia, Bogota, Colombia, as my father's Colombian, and I wanted to reconnect with my roots. But also during that time, I started my master's in global public health with a specific focus in infectious disease and disaster and emergency prevention and communication as well. And during that time I studied, and while I was studying, the pandemic hit. We have to look at the positives and negatives of this pandemic, and being so specialized in global public health, the COVID-19 pandemic was something that I could study, and something that I'd been studying and knowing that it was going to happen in some way or form. And so I ended up writing a paper on Australia's Prime Minister Scott Morrison's communication in COVID-19 over the first wave of the pandemic, and that was quite interesting. But during that time, I had thought to come back to Australia when the pandemic started. I said, I am an intensive care nurse with very high skills, working with machines like ECMO and advanced ventilation. I should be on the front line. When I looked at Australia, I saw that Australia wasn't actually doing so bad in the beginning of the pandemic, and everyone was living relatively normal, whilst I was in Bogota, locked up for nearly 6 months in strict lockdown, and with borders closed and flights being nearly impossible to book or get on because of the border closures and also lack of flights. So I ended up staying on in Colombia. And during that time, I finished my master's. Things were getting back to normal in Colombia, or the new normal. And I thought, look, I'll come back to Australia. I'll get work done, and I'll have some more experience. I'll have life experience of actually living through a COVID pandemic, which Australia had been avoiding for some time. So I booked my flights in March, wanting to come back in early September, I packed up my life in Colombia and flew to Mexico, where I was due to get a flight on September 11th back to Australia. I was not notified by the airlines. I only found out that I had been waitlisted and then kicked off a flight a week before, and was required to call Qantas and ask them why. I had no reason why. Obviously, I'm aware that there's caps and restrictions of entering, but I did make a note saying that I was an essential worker and that it would be for the benefit of the Australian community that I would be allowed back in and have an exemption to get on a flight. Unfortunately, the airlines continued to say that they had nothing that they could do about that. After finding out that my flight was cancelled, my mum, who is a GP who runs a practice in inner West Sydney, also was quite upset about it. So she contacted the local minister asking what was needed to be done. She also contacted DFAT, and she got in contact with Brad Hazard, asking him what was required to get an exemption for me to come home. Unfortunately, after a lot of scrambling, a lot of personal contacts, going to the media, we finally received a response from Brad Hazard, who's said that he has sent the information off to New South Wales Health, and New South Wales Health is the group of people that are required to make the decision that would then allow me to get a CAPS exception on a flight. But in order to get that process to an airline, I have to go through a flight agent who then puts me on a wait list. So at the moment, I have no flight in sight. I am in Mexico with limited amount of money, wanting to come back and work and provide some response to the COVID pandemic in Australia, but it seems to be proving more than difficult.
As the chief nurse and midwife in Metro North, I have had a number of roles during the pandemic, COVID-19 pandemic. They've included being the incident commander, they've included being the person who facilitates the workforce, nursing and midwifery workforce largely, but more broadly other workforces as well. But one of the most important things of recent times is the fact that we have to vaccinate a significant proportion of our community. So the magic number, 80%, is going to require every nurse and or midwife to be mobilised to actually provide vaccination. And that also extends to myself as the Chief Nursing and Midwifery Officer. I am a clinician. I long have espoused to be a clinician. It's been a long time, obviously, since I've worked at the bedside, but I still have many clinical skills, and I believe that it's important to lead from the front. And one of the ways I can demonstrate that I lead from the front is to actually make sure that I maintain clinical competence. So I've been out vaccinating with my colleagues at our mass vaccination hubs, both within facilities and also at some of our community hubs as well.
As I shared with our Federal Health Minister, the Honourable Greg Hunt, earlier this week, the nursing workforce is in growing crisis because of really complex and systemic issues. There's almost 400,000 registered nurses in Australia, but with caring for COVID and non-COVID patients, it's becoming increasingly challenging right through from the undergraduate experience through to retirees. We have had feedback from thousands of nurses around the country, including many of our members. And what we've been able to do, we really appreciate the honesty and the stories. We can hear the concern. We've been able to collate all of that into themes and present that to the Minister. And we're also working with employers and jurisdictions to make sure that the issues that are happening in one particular area can be fed back to the government so that we can really make a positive change. Not every nurse is able to work in a direct face-to-face clinical environment, and so we need to support nurses that want to contribute, that are perhaps being underutilised, to be able to work in indirect positions or in the virtual platform of delivering healthcare. And we've had great response and uptake, but we obviously still have a lot to do because nurses are struggling and need to be supported. Our members nurses around the country have let us know that the breadth of the challenges are in aged care, primary care, as well as the acute sector. And that includes occupational violence is alarmingly increasing, the issues of workload, and particularly where nurses are needing to be furloughed, that's taking hundreds, if not thousands of nurses out of being able to work for at least a couple of weeks and getting that replacement workforce in to support with the workload. The PPE and the requirements of changing practice and being able to have a therapeutic relationship with our patients, which we value very much, and our residents, is becoming increasingly more challenging as we care for not only the people that require our care, but their family and loved ones. To be able to support our undergraduates with clinical placements, as well as our workforce to be able to manage in a lockdown situation of taking care of their families and homeschooling, it really is a breadth and a range of issues. And nurses themselves are worried about their own health and well-being, and do have their own health needs to consider in these difficult times.
Metro North is the largest hospital and health service in Australia. As a result, there are 10,000 or nearly 10,000 nurses and midwives employed in Metro North. 2021 has been, and to a certain extent 2020 as well, has been really exciting for nursing and midwifery. It's been a tough year. There's no questioning about that. We have done roles and taken on responsibilities that never before we would have. But I think we need to put it into perspective and think about what opportunities have been offered to nursing and nurses and midwives, and in particular our new graduate workforce. So Metro North, as the largest employer of graduates, probably in the country, but certainly in Queensland, last year I took 450 new graduates for the whole of 2020. In 2021, to date, I have taken in excess of 700, and the number is still growing. We've got nurses working in vaccination hubs. We've got them manning fever clinics. We've got them working in hotel quarantine, as well as through traditional bedside roles that nurses and midwives normally take on. So it has been a different year for our graduates. We've started graduates in vaccination hubs and then transitioned them into acute and subacute care. But it has been really, really exciting. And I think we need to look at the negatives that have happened and what we've actually done, but we also need to think about the positive things and the opportunities that we've actually been able to provide for our new graduates. I actually consider that will actually help save us in the future as we move forward with nurses and midwives. We've been talking for a long time about the global shortage of nurses, and much of that has been because we haven't been able to employ them, whether that be due to fiscal restraints or whether that's due to people deciding to use nursing as a stepping stone for another career opportunity. But we've actually employed more nurses in 2021 than ever before. So I think that it's a really unique opportunity. And these graduates, can I just say, they're second to none. They have been absolutely outstanding, and I have been so proud to lead such an exceptional workforce. I've vaccinated beside some of these graduates, and they're as good as I am. With all due respect, they have been just amazing. So I take my hat off to them, and I also take my hat off to the tertiary sector who has trained these exceptional young men and women, and some of them are my age and older, but these graduates are just wonderful. So thank you to our university sector, and thank you to the industry, because they have actually provided the undergraduate education as well. So it's been an interesting year, a challenging year. It's not a year that I'd like to revisit, but it's also a really exciting year.
One of the things that I've always loved about the Australian nursing workforce is that it is diverse and it is inclusive, and it reflects the population. Our population has 1 in 4 people born overseas, and so the importance of the inflow of nurses who have trained overseas and want to work in Australia or studied in Australia and want to get registered here is a very important pipeline, as is making sure that the class of 21, which will see almost 20,000 third-year nurses graduate, get employment into the system. And so what we need is a very healthy mix as people choose to retire or want to select this profession, that we've got good flow, healthy turnover, and most importantly, that nurses have a right to choose where they want to work and not feel pressured. And the disparity in pay is one of the contributors. And that is why we will continue to champion that nurses should and need to be working in vaccination hubs and to be able to work where they choose and not be forced to stay in situations that help employers without thinking of the value of what every nurse brings to their place of employment. Nurses represent the best of humanity. Anybody who decides to study and choose a career pathway in nursing, it knows that they want to help others and make a difference to the lives of many. And one of my greatest suggestions that I would give to any policymaker, any leader or any politician is to be respectful of our profession and all professions that work in this field that are stepping up and stepping in to make sure that this nation remains as safe as it can. And so the policy needs to be flexibility and inclusion, and most importantly, listen to nurses and make sure that you're being guided by the experts that will be providing care in every postcode in Australia to every person that they possibly can in all communities.
2020 was the year of the nurse and midwife, and it was a year that we couldn't actually celebrate too greatly our achievements. But what I think that it actually has done is it actually has put nursing and midwifery to a certain extent front and centre. It has actually demonstrated that we can stand up, that we are a resilient bunch. And I'd like to think that 2020 to 2030 should be the decade of the nurse and midwife, because we've got a long haul with COVID-19. It's going to be a tough few years as we recuperate from this, even once we've all been vaccinated. So we need to really stand up and be counted. And our policymakers, our administrators, people who actually can help us influence need to acknowledge the nursing and midwifery input in the last 18 months and certainly beyond that. So whether or not that be through remuneration, whether or not that be through acknowledgement, we need to recognise the really unique contribution of our professions. It's been a tough year. It's going to continue to be tough for a little bit longer yet. But we are doing a fabulous job. And I think nurses and midwives need to celebrate what they have achieved, celebrate our professions as we move forward, be proud of what they've contributed for the last 18 months and what they will continue to contribute for the next few years. I'd like to say thank you to each and every nurse and midwife across Australia and beyond, because it's not just our own country that's suffering or feeling the pinch. And we've had it relatively easy in Australia if we compare ourselves to other countries. But it doesn't make that it's any easier for individuals. And Kylie is absolutely right. We need to look after our own health and well-being. We cannot go on working at this level. Nurses and midwives have worked 24 hours a day, 7 days a week, many of them for a long period of time, and we've all seen the pictures. They're not propaganda, they're actually the truth. So we need to live our truth, for want of a better word. We need to celebrate what's great, we need to acknowledge what's not so great, and work out strategies to actually deal with them and recognise the contribution of our professions.
I think as a skilled intensive care nurse with a job pending after having an interview with my previous hospital and employer, that I could make a big difference, because I would be a skilled worker coming back to a workforce and being in a team where I have already worked within. I'm highly skilled. As I've said, I have good ventilation skills, dialysis machines, ECMO, and I think that I could really relieve the strain that's being put onto the healthcare workforce, also provide training and real-life experience of living with COVID in a place other than Australia as well.
Last year, the world went to war with a virus that we can't see, but we've certainly experienced, and it's changed every person's way of living and way of being. And the army in this instance has predominantly been women all around the world, certainly frontline workers, including healthcare workers, and a large majority of the nursing profession, in fact 90% is women. And what I would like to see for every policymaker and decision maker is to pay the respect that we deserve. We do not need lip service. We need that respect, not only in fair and equitable pay and to close the gender gap, but in also giving the right to have access to be properly isolated in hotels, in quarantines, and to get the downtime and the support. Natalie actually represents an Australian-trained nurse who has gone overseas, highly skilled, highly trained, highly valuable, and there shouldn't be a politician in New South Wales who can sleep peacefully tonight knowing that she is not on a plane returning to step up and do her civic duty. This is someone who is wanting to come home, wanting to make a difference, and wanting to contribute when many others can't. And I think that it's absolutely unacceptable that any politician should allow bureaucracy to get in the place of allowing that to occur. And even 24 hours is too long for that to happen.